So today I wanted to talk about NP school. I've really been thinking about this quite a bit. I've actually been looking at schools. I've been weighing my options. I've been looking at the cost of tuition, how much amount I'm going to projectively make in a sense. I'm also looking at what do these psych NPs actually do, because I haven't really worked at a psych unit. Actually, I've never worked at a psych unit. I did have a psych clinical when I was in school, and that's the only time I really had hands-on experience with people, with patients that are in psych. So I was thinking, maybe the family NP route would be good, or the NP route where on the unit, more of like the acute setting, just those kind of things. And I don't know, for some reason, the NPs in the family practice, they were a little bit more appealing to me than the acute care setting. I'm kind of slowly getting over the acute care setting in a way, but I do plan on still working for quite a bit of time. I'm also still planning on working PRN if I do go to school, or part-time. So I've been kind of thinking about a lot of these things. So family practice was a little bit more interesting than the whole acute care setting route, because like I said, I'm a little bit over it in a sense. I still really enjoy doing it. I still like the ICU environment. I still like patient care, all that kind of stuff, all the things and knowledge and critical thinking and just the physical work that comes with being a staff nurse. It's just, I feel like I'm reaching that age where maybe I want to pursue something out of bedside. I'm 29 years old, so I'm not old. I don't feel old. It's just like in your early 20s, you're kind of thinking about school, but you just got done with your bachelor's. So you're like, let me get a little bit of break, a little bit of experience, and then go back into some kind of in that phase in a sense. So with the NP route, I feel like it still allows me to hone in on my nursing skills, but also have a little bit more autonomy, a little bit of say what actually goes on. So the acute care NP is kind of out of the window. I don't really want to be putting in lines. I've worked with nurse practitioners on unit in the ICUs, various ICUs, medical, neuro, cardiac, and I already have a really good idea of what their scope of practice is and what they really do. And I don't know, it's just really not for me. I know the NPs that I've worked with, there were always the ones putting in lines, the ones that were assessing the patient, if they have to go on pressors, if they're acutely having an MI, do we need to give them inotropes? Do we need to maybe think about putting a balloon pump in this person, starting them on CRT? So those kind of things, which are really, really cool. It just, I don't know if I want to do that long term and always be in that environment.